It was overwhelming. We were planning for something and we didn't know what it looked like. We went from a 15-bedded unit in one level to a 35-bedded unit on 3 different areas with the same amount of intensive care nurses. So we were given a massive support team to all work together, and I think it worked really well.
The planning for this pandemic started all the way back at the end of February, beginning of March, when the Trust established a COVID planning group. We had enormous support in the Trust through the Gold and Silver Command teams. I always felt, as the clinical lead for ITU, that I had absolute total support from these teams. All I had to do was pick up the phone or walk up to the command centre, tell them what the problem was, and I was always amazed actually at how rapidly things seemed to be sorted out. When we put requests in for equipment and this sort of thing, redeployed staff, it sort of almost just happened, and I think it was, you know, a real credit actually to the management teams that they supported us so well.
We knew something was coming, but we didn't expect the severity and how extremely busy it was going to be, and the unpredictability of it all.
I was worried that, having been an ITU nurse, I was worried that actually working with people that may not be familiar with the environment might be stressful for them, but actually will be stressful for the already established ITU staff.
Nurses were redeployed from all over the hospital, from A&E, from the wards. We've had physios turn into ITU nurses. We've had to give some training. Most of it's on the job. They've all been fantastic.
Our support workers were amazing. They stepped in, they stepped up, and they will tell you that we have communicated nearly every day. We've been able to speak about our experiences, and that has been really, really helpful.
I thought they did fantastically because they never once showed the fact that they were worried that they had to look after an increased number of patients and had staff that maybe weren't familiar with the environment. They've been fantastic throughout.
It's taught me to be a lot more hands-on, and it's given me a lot more confidence, and especially with the team around me, they're all amazing. Nurses and staff members, all the physios, they've all been so great to me, and I think it's shown me how to work in a team a lot better.
I was way out of my comfort zone. There was no training beforehand, and the nurses were amazing. The ITU nurses worked just relentlessly to keep things going, to keep things running as smoothly as possible.
How quickly everyone mobilised and changed roles in really testing circumstances. So I was part of the proning team, which was, you know, putting people onto their front. And it was something that I had never done before. I'd seen it before. Most of the physio had never done it. And by Easter weekend, there was one day we did 15 in a day, and we had come together as a team. And it became a really succinct process. And I think in stressful times, for people to learn something new and to do it successfully and safely is absolutely great.
The strangest thing was, after spending 12.5 hours with these people, you would meet somebody in the changing room, they'd speak and you'd say, "Oh, so you're so-and-so that I've been working with," but when all you can see are the eyes, I didn't know who these people were. So it's actually been lovely to meet people from all the other aspects of the hospital who've come to help us, and we thank them hugely.
These patients have been the sickest level 3, so they're all on breathing machines. Often their kidneys don't work as well, so they have required so many drugs, so many infusion pumps, alarms going all the time. Obviously, everybody has had to step up a gear just to get procurement. Have been fantastic. Pharmacy, we've had to use far more drugs and liquids and things that we've just never known it in this magnitude before.
Our pharmacy team normally top up the medicines to a predetermined level, but obviously that's been blown out of the water by the type of patients that we've had. So we've been giving a lot more certain medications, and rather going on and speaking to the staff about their needs rather than what we would normally give them.
We've increased the number of pharmacists that are trained in critical care medicine just to help support these extra inpatients in ITU. And given the increased use in antibiotics, we're also keeping a closer eye on antibiotic consumption, stock levels, and trying to maintain antimicrobial stewardship during these times, and to still make sure that we're using these antibiotics appropriately.
families are a really big part, families and friends, loved ones, big part of our working day, but they're not allowed to visit. So we've had the chaplaincy have been on board and the junior doctors making phone calls to the families every afternoon. And more recently, when the patients are able to consent, we've set up FaceTime so that they can FaceTime the families, and that's been invaluable to everybody.
Chaplaincy has been involved with the ITU for quite a while now. Over the last 4 years, we've been developing an ongoing relationship with as being part of the multidisciplinary team. So it naturally segued into what was happening once COVID struck, and we found ourselves in the middle of the real heightened response. It turned out that the best thing we could do was to support the families of the patients who were in ITU, and alongside that support the nursing staff and the consultants and doctors as they worked through alongside those patients. And we could be that engagement with the families who were often in isolation themselves, having the last thing they'd seen, their loved one being packed into an ambulance and the door closing, and they didn't know whether they would see them again. Now, unfortunately, in some circumstances that was the case, and the patients unfortunately died, and we would support them on the end of the phone. We would provide end-of-life prayers with them if they wanted that on the end of the phone. I would draft in my rabbi or my imam, whoever was needed to provide that support.
The joyous moments have been when you finally get to meet patient families and actually meet them face to face. You are that recognised voice on the end of the phone. You provide some stability and some consistency in the last however many days that they've been living through this traumatic experience. And then being able to see them reconnected with their loved ones in a garden or upstairs in a therapy gym actually makes this experience so much more rewarding as you see their smiles.
The love and support that have been shown by everybody in the hospital, the community. You know, we're being overfed. We've had cards from ex-patients wishing us well. It's been amazing.
If I was to reflect on our whole experience, and I don't want to speak for the team, but I think I can sense there's a real feeling that we've been on a roller coaster journey. Emotionally, with its ups and downs, and it has taken a huge toll on the staff.
My lasting memory is of the first patient that I intubated, who, as he went to sleep, grabbed my hand and started crying and begged me not to let him die. And it stuck with me because I was convinced that despite all our best efforts, that would happen and there would be nothing we could do to prevent it. And he survived and he went home.
I learnt so many new things, new skills, and even though it was exhausting, I came away feeling really proud that I was part of that effort. We were on the front line and everyone was doing their best to make the biggest difference they could.
From a personal level, I think the memories that I'm going to take away more than anything else is the resilience, the hard work and the flexibility of our team. Because of the increase in number of patients, we were training up junior dietitians who've never stepped foot on an intensive care unit before, and they did that without asking questions and did an amazing job. So I'm really proud to be part of that team.
Because we all appreciate each other and we all support each other at the moment during this hard time. Yeah.
I'll put it in a few words here. Challenging for various reasons, interesting, heartbreaking at times. More recently, it's been relief, joy, encouraging.
The feedback that I'm getting from the staff now generally is that it's been one of the most fulfilling and rewarding experiences, perhaps, of their careers to date. We have felt very emotionally attached to some of the patients that we've come to know, some of whom have been in the critical care unit for over 50 days. And in light of the fact that their families have not been able to visit, there's been a real sense of needing to manage the patient's sort of mental well-being very much as well. And it's been incredibly rewarding as some of our patients now are leaving the critical care unit and actually even having trips to the hospital garden where they're being reunited with their families is one of the most moving experiences that we could have over this entire COVID experience.